Today I'm going to be talking about how to do a brief exam on your horse. So first I'm going to go over just how to take a temperature on a horse. So you just want to use a regular digital thermometer that you get from Walgreens or any grocery store, and you want to take a rectal temperature. A normal temperature on a horse is going to be somewhere between 98 and less than 101. If you're over 101, your horse is running a fever. Unless it's in the middle of the summer in Phoenix and your horse just got out of trailer, they might be higher, but otherwise it's going to be between 99 and 101. So just put a little lube, or you can put Vaseline, or you can even spit on the thermometer. And you want to go back here. I recommend the thermometers that take like 10 seconds because your horse usually won't have much patience. Stand to the side of the horse just in case they kick. And you want to lift the tail to the side and just insert in the rectum right there. And then make sure you turn the thermometer on after you insert it, because especially in Phoenix, if it's in the summer, you'll get the outside temperature. And just hold it until it beeps. I already got a beep. So my horse's temperature is 97.7. That's okay. I just said 98 to 101, but that's a 97 temperature is normally okay if your horse is acting fine. And so the next thing is, we're going to bring him over here. You can, if you have a stethoscope, you can take your horse's heart rate, and I usually like to take it on the horse's left. If the horse is facing this way, this is the horse's left. Their heart is right behind their elbow right here. And so you just want to listen right here. This area right in here for the horse's heart rate. Horses have a very slow heart rate. Normal is 32 to 40. So what I do is I count to 15 seconds with my watch, and then I times it by 4. So if a horse is 10 times 4, your horse's heart rate is going to be 40. The other thing you can do if you're worried about your horse or concerned is you want to check their hydration status. You can do this by checking their skin tint. I actually prefer to use the shoulder rather than the neck, just because sometimes the horses are sweaty, or in the summer they can be sticky and it can be delayed on the neck. So for foals or horses, you want to use, I'm just going to pull him this way a little bit. There you go, buddy. You just want to use the shoulder, pull, it should bounce back within 1 to 2 seconds. If it's 2, 3, 4, 5, 6 seconds delayed, then they're dehydrated. So use your shoulder, see how it bounces right back. And you can zone in on that if you need to. It should bounce right back for the horse to, for if they're well hydrated. The other thing is you can take the horse's respiration rate. Normal for a horse is going to be 12 to 16 during the winter. In the summer, they tend to be a little higher, usually 16 to 28 in Phoenix because it's hot. I just usually watch their abdomen and see their respiration rate, and again I do 15 seconds and then I times it by 4. So you can just visually look at the horse to get a respiration rate. And lastly, if you're trying to check to see how your horse is doing, you can check their mucous membranes, which is their gum color. And I might ask an owner to this, so you can zoom in on the horse if you want to. Easy, buddy. He wants to eat. So you can just lift, hope, stop. Lift their lip up. You want their gums to be nice and pink. So, nice and pink. You push on their gums right above their tooth, and it should come back within 2 seconds. Let me show you again. Hope. And the gum color should come back within 2 seconds, and they should be a nice pink color. If they're purple, red, or if they have a dark line around their teeth, that's an indication things might not be going so well. You can stop.